Hi, this is Bedrest Coach Darline Turner, owner and founder of Mamas on Bedrest and Beyond, and welcome to Video Wednesday for this Wednesday, April the 30th, 2014. I hope you are all well, and I'm about to be a bit of a downer, but hey, that's my job. Today's topic is let's not lose focus of what's truly important. And I'm going to try and calm down because I was just on my computer reading through some things on the web and got into a discussion, came across an article and got into this discussion about ancillary providers and people who support women who are pregnant, etc. People like me. So I was amongst my tribe and we were talking. And there was a woman who had shared her story, a mama, of how she almost lost her baby who had been completely healthy, had a good pregnancy. She had developed some gestational diabetes, but the doctor was managing it and everything was going okay. And she hired a doula who basically undermined everything that her obstetrician told her. And as I'm reading through this article, my blood pressure is rising. I can feel the heat rising in my face because the doctor's telling her to do these things about diet and exercise. The doctor was telling her, when you go into labor, I want you to come right in because there are some things we want to check with the shoulders. We want to do this. Had really laid out for her. And I think had given her really good advice and really had made her a part of her medical team. But she had hired this doula, and everything the doctor says, you don't need to worry about that. You don't need to do that. That's not important. And I'm reading this going, oh my gosh, this is not okay. But anyway, long story short, the woman goes into labor. She does not show up to the hospital for 2 days. Her water had broken, and she doesn't go to the hospital for 2 days, which right there could put her at risk for infection, but she was positive for group B strep. It just was a catastrophe, a cascade of errors. And when this little one was born, she was whisked away to the NICU because she wasn't breathing, had oxygen not to her brain for too long. They thought she was going to be brain damaged, had seizures, the whole 9 yards. Long story short, by the grace of God, literally, this little one is fine and this mama is fine, but she's really struggling with her own feelings and things. So those of us who work in the birth world, I'm reading this and we're talking back and forth about whether the doula was definitely out of line and why she was and what should have been said and this and that and the other thing. And it upset me, quite frankly, because, those of us who work with moms, we love babies, and we want the best for you. But I think there is a really fine line between wanting the best for you and telling you what the best for you is. And this is what I want to talk about today, really, is let's not lose focus of what really is important. And the bottom line is the whole point of this whole situation is to get you and a healthy baby home, period, in the conversation. I don't care if in the long run your OB says you need to stand on your head to get this baby out. If that's what that OB thinks, and I say go with it. It sounds a little hokey to me, but I look at it this way. I run Mamas on Bedrest and Beyond. I was a practicing physician assistant. I don't practice anymore. I have not touched a perineum in, 12 years now. And yes, I used to deliver babies. I used to do, yes, I did that, but I don't anymore. And when I write things, I write it for you to take to your OB and say, would this be good for me? I write them for you to take to your midwife and say, hey, could I try this? Would this be something that I could do? It has never been my intention to replace your healthcare provider because let me tell you something. You have problems at 3 a.m, don't call me. I have no idea where you may be. I have no idea of your situation. I have never laid hands on you. Most of you, I've never laid eyes on you except for a little tiny picture maybe on Facebook. And I do not have the skill, expertise, licensure, what have you, at this point to properly treat you. If I decide to go back into practice to work in an OB office, that's one thing. But right now, when Mama's on Bedrest and Beyond, I'm not going to tell you don't do something. I may say, you might want to talk to your doctor about that, because if it sounds hokey to me, I will say you need to ask that question. You need to ask about that. But I am not going to tell you, don't do that because that doctor's crazy. No, because at 3 a.m, when you're having contractions or when you're, feel like you're bleeding, you're having pressure, you're going to call that doctor. You're not going to call me. And you need to respect him or her enough that if you're going to call them at 3 in the morning, if you're going to call them asking questions, if you're going to say that you rely on them for their expertise, well, then adhere to it. It's really that simple. And if you feel like, allergies up, if you feel like that person is not being straight with you, if they are giving you information that you don't agree with or just seems weird or whatever, then you switch to another qualified provider. You don't ask your doula. You don't ask me if mama's on bed rest. You don't, go to Baby Center like, hey, is this what I should be doing on babycenter.com? You'll get a lot of opinions, but you're not going to get really good medical information. And that is what you need. What my entire goal is with Mamas on Bed Rest and Beyond, and actually with all the work that I do, because I do other women's health work, is to provide women with information so that they can make a really informed medical choice. So that means, doctor says, well, you have gestational diabetes and you're probably going to need a C-section for shoulder dystocia. You may say, is that true? Is that true? Well, it is sometimes, a lot of times, but not every time. There are women who deliver babies having had gestational diabetes, and they're both just fine. But you have to look at, is your gestational diabetes controlled? Did you have to be on insulin? Are you having a big baby? What is the size of that baby? They can do a crown rump measurement and tell you how big your baby is. They can measure the shoulders with an ultrasound and tell you how big that baby is. And look at your pelvis and see what's going to happen. Because if the baby gets stuck, that's a problem. But these are things you have to ask. You have to be aware of. Even if you don't understand, say, doctor, what does that mean? What does that mean? That's a very simple question that can give you a ton of information. But that is my goal, for you to, at least, if nothing else, have the confidence and the assuredness to stand up for yourself and say, what does that mean? Is it really necessary? Okay, it's necessary. What should I expect with it? Are there any complications I should look for or be aware of that could happen? So if it happens in the middle of the night, I know how to handle it. That's what I'm trying to give you. I can't give you medical advice. I can't give you medical care. I can't put my hands on you. I can't touch you through the screen. Maybe one day Star Wars, something like that, we'll have that. But right now I can't do that. And you really need to listen to your healthcare provider. You need to partner with your healthcare provider, and you need to read and educate yourself, because not all health providers are good. Not all health providers are bad. Not everything that's natural is good. I mean, a lot of people are like, but it's herbal. It's fine. Herbs have medicinal qualities. That's why they're herbs. That's why people use them. You have to understand what things work where, and that's where it comes education. You have to keep yourself informed. That is what I want to do here. I want you informed. I want you to hear from other mamas like, oh, when I had labor in my back hurt, I used this pillow, or I used that cold pack, or my husband brought me this and it really worked for me. I want to give you everything possible that you can have to have the best possible outcome. But that does not include medical care. And if at any time you hear me saying medical advice, please call me on it, ping me on it, say, are you saying that I have to do this? Because I am not saying you have to do anything. I'm not qualified to say that to you, coming to you from a little bitty screen or in a blog or whatever. I'm not qualified to do that. And anyone who tries to do that to you, except, I don't know, WebMD or something, even then, even a doctor is not going to tell you something from a blog, because they don't see you, because what a person describes and what you actually see and feel are two very different things a lot of the times. And you have to see it. You have to feel it. You have to, look at it in the context of a woman's body, of her situation, to really get an idea of what's going on. And you just can't do that virtually. And you can't do it like, I'll go to conferences and people will say, well, I have this. Can you tell me what to do? And the doctors are standing there like, no, I can't tell you. I would need to examine you. That's the difference. So, I'm sorry, I just ranted, but I saw this post and this woman who almost lost her baby listening to this doula, and it just set me hair aflame because I'm like, first of all, doulas are not at all medical professionals. They are support people for mamas who are giving birth. That's it. They are there to support you. They're there to rub your back. They're there to get you Kleenex. They're there to, give your shoulder if you want to cry. They're there to, that kind of stuff. They are not there to check your cervix. They're not there to measure your belly. They're not there to wrap your belly after episiotomy, anything. They are ancillary. They are support. The people who you need to listen to and then mull on their words are your physician, your midwife, your neonatologist, your perinatologist, the ultrasonographer, the people who actually have the licensure and expertise to lay hands on you and to examine you and to put all that information into a context so that you can then make your decision. So it's a little bit heavy, probably a little boring, but I have to say, and it's been actually, I love dialoguing and debating, as you can probably tell. So I've loved talking with other birth workers and getting their perspectives, and we've been back and forth and everything, but I really want to drive the point home. And I have to say, y'all are savvy. You know the drill, because having been on bed rest, you've had probably more pokes and prods than the average woman, and you know when something stinks. You know when, like, this is not right. And because of your situations, you're much quicker to call somebody on it. And that's great. That's a gift you have now. So I'm not as worried about you, but I wanted to just reiterate the point. In the event that, you're like, well, my friend's doula said, or my friend said that I'm going to do, and I'm going to follow that. It's like, no, baby, don't do that. Do not do that. And, trust your OB and find someone. If you don't trust your obstetrician or midwife, then you need to find somebody else. Find one that you trust, someone that you can work with, that when you're crazed in labor or whatever, that is going to take care of you and knows you and knows your desires, and it's going to follow that, because that's what's going to take you and your baby home happy, healthy, and thriving for years to come. So thank you for listening to my rant for April the 30th, 2014. Again, don't lose focus of what's truly important. You want to go home with a healthy baby. Even if your baby ends up in the NICU for a little bit. Mine did. I went home first. The long-term final goal is to go home with a healthy baby. And you need to listen to the trained people who can do that. And if you're not feeling comfortable with who you are, with who you have right now, switch. But make sure that this person in your dire times of need, like when you're in labor and you're like, is going to take care of you, and that you trust them implicitly, and you're going to be great. Don't lose focus of that over, well, I want to be all natural, and I want to have a natural birth, and I don't want to have an epidural in it, because, honey, you get in there and you need it. You need it. Don't feel bad about it. Don't apologize for it. You need it. You need it. Take it. Do it. But make sure that the people advising you, you trust implicitly. I wish you all wonderful births, happy, healthy, big, fat, squishy babies, and a wonderful day from Darline Turner, Bedrest Coach, owner and founder of Mamas on Bedrest and Beyond. Take care.